Just I think one. I'm going around in circles because I'm going backwards today. I'm doing everything in reverse. You watch me swap it around again.
It's so hard to determine that that's the cause, isn't it?
So from a detection standpoint, if I'm judging it,
Good morning,
I'm not talking about the administration and all that. Yes, it's quite difficult. It's a large molecule. It can degrade. You have to suspect it. So it can be challenging to detect. Absolutely.
As understatements go, challenging would be a good way to put it.
Okay.
It's very tough to do.
Correct.
Now, are you familiar with the Clarksburg VA cases?
I don't know.
Okay.
This is my one and only foray into West Virginia.
Oh, yeah.
And I'm
West
not
Virginia.
particularly a nature
Touch
person,
your
so I don't
mama.
think I'm like out here otherwise.
You're a city girl.
Yes.
Okay, fair enough. Let's, if I could have defendants 12, please.
Or we can watch this
The
on
chart's
time
right
and a
there.
half.
But that's 10.
Oh, 12 is my report.
It is.
I think she may.
Yeah, I have the formal copy if you need it.
You, okay.
Yeah.
Let me borrow that from you, please, Doc. Let's just go through some of the opinion and supporting facts. And that's what we were talking about earlier.
Sure.
A brief history is that Michael Cochran was 38-year-old with possible history of seizure.
Yes.
That's all it is. It's possible. You didn't have anything affirmative in the medical records that said this guy has seizures.
He had a prior episode.
Episodes,
Okay.
but did they say he had a seizure disorder, or did they just say he has seizures, or we don't know? Suspected.
Right. It was one episode, and I don't know that it was worked up further. So I noted the history of, they said possible seizure disorder, I think resulting from that episode that he had. So that's how I stated it.
Is a possible seizure the same thing as a diagnosis of
No,
seizures?
no.
Okay. And the same thing with the possible brain mass. That's not the same thing as here's a brain mass.
Correct. Yes,
Okay.
I think what they were lending it, and this is directly extracted from the medical records that I reviewed, that they were trying to see if he had a brain mass as a cause of that seizure, adult onset seizure.
And nobody ever found out.
Not that I'm aware of.
Complained of dizziness and basically fainting. Who did he complain to?
I don't recall.
Okay. He later fell to the floor and was unarousable by his wife. Where did that information come from?
Again, this is within all the materials given to me. I couldn't cite a page number or anything like that.
Okay. She, being the defendant, drove him to the ED. That's the emergency department at Raleigh General.
Correct.
Okay. And he had vomited. You list some other things. You don't put in there that his blood glucose was 21 at this point in your report.
It's 2 paragraphs down. If you see it, it's
Right.
not far because it's still within the background.
It is.
Okay, so I don't really get into the labs until later. So it's all with its partners, all the laboratory results I talk about.
Okay. Investigation showed he was taking some unspecified benzodiazepine. Who did the investigation?
I don't know. There was some report of that.
And it was in the form of a positive urine screen, right?
Well, that's there too.
Okay.
Yes,
But
definitely.
the investigation that showed he was taking some unspecified benzodiazepine, there really wasn't any investigation that you know of, was there?
I can't cite a specific. I don't have the police report either. It was never provided.
Same thing with the anabolic steroids. That's just something somebody reported to somebody else.
Well, yes, and any potential history that is reported by whoever is still important, and that's why I noted. You can't just you take it at face value.
Okay. You note his longstanding use of pseudoephedrine. Was that Sudafed? Is that
That's a brand name in medical school. We're always taught to do the generic, and pseudoephedrine is how it's documented in that West Virginia state report as well.
okay? But I mean, if that's what he thought he was taking, Sudafed, that would just be a name brand of the stuff.
So he was prescribed it. I don't know where it was tracked. So I don't know if that's tracked by a pharmacy. I don't know exactly how the states run, but it had months and months of use
I don't know.
documented.
Okay.
I was listening to, I did hear a little bit of Recovery Addict yesterday, and his opinion was that, she's been able to convince so many people out of so much money, maybe it would be worthwhile her testifying if she's convincing, but she's apparently not. She was going to, but yeah, apparently not now.
Before you started working with dead people, you were doing other doctor stuff,
You don't think
right?
she needs to?
Correct. So I always tell people that I did a year of training to know what it's like to treat living people.
Okay.
I think they've created enough
And
now.
had you did a rotation in the ER or ED?
So
They may have
let
done
me
a shit
backtrack.
job,
So
but
Go ahead.
my only experience in the ER or ED, we sort of use that interchangeably, is through medical school. My preliminary year that you're referring to, so that means similar to Dr. Halsey, the first year of internal medicine training is what I did at UPenn. So I graduated medical school and did that. I did not have any other emergency room training as a part of that internship. Okay, we would go and get patients. They would get worked up in the ER and then admitted to internal medicine, where I could be their intern, their first doctor, their junior doctor. But I never represent myself to be an ER expert or ER physician.
If one of those patients had presented to you from the ER with a blood glucose of 21, that would have gotten your attention, wouldn't it?
I sure hope so,
Yeah. How come?
because it's low.
Very low.
Correct. And I'm hoping the ER wouldn't send someone to me up to the floor. I hope they would take care of that. That's to me what an emergency room should do.
Mhm.
In your history of this case, were you told that at one point the defendant made the claim that this Michael Cochran hit his head so hard that he chipped a stone countertop?
I don't know that. I just know that when I read through the medical records, there was a documentation of a fall with possible head trauma. He had a CAT scan done and there was no internal head trauma. And as far as I know, there was nothing like a bump or bruise notated in the medical records. That's really what I'm relying on to make my assessment, because obviously histories can vary, as we've discussed. And so I rely more on the medical history and the medical notations made.
Had he hit his head hard enough to cause damage to a stone countertop, you'd expect to find something, wouldn't you?
I'm sorry, find something where?
On his
Damage
head.
through a CT scan, visible bruising, visible cuts, that kind of
Right.
stuff.
So I think the method of detection depends on the answer. So whether it's a physical exam, like a bump or a bruise or laceration, yes. Hard falls, as surprising as it is, don't always yield internal injury. So even at autopsy, we see that people who don't catch their falls, they might have a laceration, but they may not have anything internally. And that's why the CAT scan is done. You can have a bump or bruise on the outside. You really need to make sure what's going on the inside. And per my recollection, his CT scan was completely normal.
And from all accounts of both medical and non-medical people, there was no external evidence of trauma.
Not that I saw noted.
Okay. There is a text from the defendant saying that Michael's been asleep since before 9:34 in the morning. There's no evidence after that he ever regained consciousness. Were you aware of that?
No.
Were you aware that when he allegedly hit his head so hard that he chipped this or broke this countertop, that instead of calling 911, she called two construction guys who carried him from the kitchen floor to the couch? Were you aware of that?
No.
Were you aware that she left him lay on the couch until he urinated himself sometime in the afternoon, about 3 or 4 o'clock?
No.
Were you aware that even after that, she didn't take any steps to get him medical care until she showed up at Raleigh General Hospital many hours later?
I don't have a detail of what happened prior. I just know what happened starting at the hospital presentation.
Okay.
Yeah.
Hey,
10. Hi, sweetheart. These
if this
patches
is a
are awesome.
mischaracterization, tell me.
Thank you.
But it sounds like you're pretty dismissive of the opinions of Drs. Krieger and Uribe.
I mean, Dr. Krieger's really a clinician. And I think as Dr. Dragovich said, she's not really an expert in classifying cause or manner of death. So I am not here to refute. I don't know honestly, I don't remember a lot of her testimony because it was outside the area of my expertise. I think Dr. Uribe has potentially overstepped. I have a different professional opinion, which I also answered with Mr. Selden, that I think it's the cause and manner of death should both be undetermined based on the condition of the body and what can and cannot be collected from the body or what was, excuse me.
And that's strictly based on the 2 autopsies?
No, and the medical records as well.
Well, you had the benefit of the MRI report from CAMC from February 8th of 2019, didn't you?
It's probably in there. Yes, I'm assuming. That's after his initial
Oh,
presentation. So assuming it's there, I don't have it memorized.
No. I understand that, but it showed that massive brain swelling, basically.
Yeah. Oh, yes. There was cerebral edema.
they're
And-
awesome.
But you're not
It
willing
really,
to say
really
that you
helped.
think that caused
Thank
his death?
you.
So I think if we get into it, cerebral edema is significant, but there's many routes that lead to cerebral edema. Drug overdose is one. Hypoglycemia could be one. But I can't just look at medical records to make a cause of death. That's what the autopsy is there for, okay? So we don't practice in a black box. We always consider the circumstances. We consider whatever records we have made available. But the autopsy is the gold standard, okay? That's where I'm looking at the condition of the body, the organs, and the main data that I take to synthesize my cause and manner of death, along with ancillary studies such as toxicology. So I am here as a forensic pathologist to opine on what I think his cause and manner of death is. And I really can't tell you what that is. His body's too decomposed. And in our field, it is acceptable to use undetermined as a cause of death and undetermined as a manner of death.
It is, but it's also the option of the forensic pathologist to state a determination of what they believe the cause and manner of death was.
They're professional opinions.
Mhm.
They are.
So you've got two that believe that it's
The defense
undetermined
has
and
kind
one
of tossed this out here that
is
there are
homicide.
these sinister sounding purchases from Mexico. Where's stage 2? Okay. Very funny, Miss Smarty Pants. It's not here. It's the FBI report. Or is that? No, I'm sorry. That's 17, isn't it?
Yep.
Never mind. 17. Dr. Haney, what's been marked for identification, it actually entered into evidence in state 17. Take a quick look at that, please.
Just to advise, I've not seen this previously.
I understand.
Oh, okay. It's quite detailed. Yes. What would you like
Well,
to look
just
at?
the conclusions.
Oh,
The
sorry.
testing.
They haven't
Results
started.
or the
Yeah.
interpretation? There's quite which one?
Yeah, could I have it back?
Oh,
No,
sorry. Yeah.
they
there's a
haven't
lot going on.
started in court day 8 yet.
Take a look at item 3.
Can I just read it?
Yes, please.
Okay.
Take time.
Item 3 was a bottle marked in part as quote enclomiphene citrate containing a clear, colorless liquid. It goes on to state it was containing glycerol and letrozole. Enclomiphene was not identified.
So the mysterious and sinister sounding Mexican purchased drugs were not what they were purported to be.
It was a different
It
one.
was one
Yeah,
vial.
Not the same thing at all.
7 months later.
This line of questioning, we don't know what these
Mhm.
substances were. They weren't actually clarified. They weren't stated. They're just unknown substances.
I bet you that was kept out.
It's the FBI report. I think it's a known substance. Wouldn't you agree with that, Doctor?
I'm just reading what they reported.
Right. But you have no reason to question the FBI lab results, do you?
I'm taking it at face value.
Okay.
That was
Just
sneaky.
to clarify, Your Honor, I'm not objecting to the FBI report. I'm objecting to the so-called Mexican substances, which were never documented. We don't know what they were.
Well, the state would agree with that. They were never documented.
I understand the objection is over. I'll preserve your exception.
This is a text from the defendant. And I call your attention to this part. Mike was so mad this AM about not being able to go today, he had to take 2 of my blood pressure pills. Did you see any evidence from the medical records of a blood pressure pill in the Michael Cochran system?
I'm sorry. Let's clarify. In his system, like a postmortem
Do you have
toxicology.
any medical records that say he had taken 2 blood pressure pills?
I don't have any data to support
No.
that. Okay.
You don't.
And no toxicology.
Right.
No.
Yeah,
And
they're
again,
good. They're
The
the,
defendant affirms
I get them
that
as
taken
well.
2 of her blood pressure pills.
They
And
smell
you know,
awesome.
medically, there's no evidence of that one way or the other. Right?
Okay. I'm not sure how this leads back to my cause and manner of death.
We're
but
gonna get
okay.
Bear with me. We're right on the doorstep.
Okay.
At 102, this picture goes out, and the defendant says that she checked his blood glucose, and it was 145. Can you read that?
No.
Oh, there you
It's-
go.
Okay.
Now you can read
Yeah.
it. That's my fault.
Okay. And it's a lot hazier on my screen as well, but yes, it's just a listing of some vital signs and a blood glucose of 145.
They're
And that's
fine.
it. 105, 106, 102.
I have no idea the timestamps cut off.
Well, here's another one
Okay.
to a different person.
Okay, yeah,
So she took a photo of him on the
that says
floor.
a timestamp of 106.
Bear that time and that number in mind, please.
Okay.
Did you know that?
No, I did not.
At 6:30, the defendant says
You get them
blood
from the
sugar
Asian shops 10.
115.
I'll
Okay.
see
Correct.
if I can
Yes,
get some
that's
for
what it
you.
says in the text message.
They're like a methylated DPT type of thing. They're good.
We can either
Oh, you
use
can't have
defendant's
heat.
10 or
No, not good
we'll
for
just
you.
use the same chart from
Oh,
your.
sure, okay.
Okay. You were not told about those two blood glucose level measurements until today. Is that right?
Correct.
The very top of your chart,
Yeah.
you base your chart on the assumption that an alleged event occurred at approximately 12 o'clock.
Correct.
The alleged event was what?
that-
Insulin.
That's when he fainted and due to possible
That's all good,
exogenous
sweetheart.
insulin administration.
Would the two readings that she claims she got, would that be consistent with the 12 o'clock on a non-diabetic injection?
It could, because I don't know what all is in his system. Obviously, there's some drugs that are not the correct ones. And I have no way of assessing what was in his system. My understanding is he used multiple supplements that are not regulated by the FDA.
Me either.
And, I don't know. And so whether they're foreign, domestic, et cetera, I have no idea what any medication's effects would be on him, his blood glucose, his other.
I've actually got two little teddy bear things that, like gummy bears, in my drawer to try, but I'm not game.
Their vitals, et cetera.
I might have
Well,
one this morning.
Those are all unknowns, and those are fair points. But we do have a known. When he got to Raleigh General 2 hours later,
May have tried
his
some.
blood glucose was 21, right?
Yes.
Yeah, so in theory, it dropped from 115
really?
to 21 in a couple hours.
Okay.
I'm just 6
Now, doctor, you are not expected to be familiar with Raleigh County geography, but I'm going to ask you to assume that this is true.
Okay.
From the defendant's residence on 4H Lake Road to Raleigh General Hospital would be approximately a 30-minute trip.
She naughty.
Accept that. For you, okay. On February 6th of 2019, at 7:30 in the evening, it would be dark, correct?
In this, well, it's February, so right, still winter time. Yes, relatively so. Yes, I would say shorter days.
Now, in your information coming to you was that this defendant drove her husband to the ER.
That's right.
In fact, his best friend drove him to the ER.
Sure.
He was laid out in the back of the SUV, and she was with him. Those are the only three people in the vehicle.
Okay.
It's night. It's 7:30 or so, and by the time they get to Raleigh General Hospital, his blood glucose is 21.
Yes.
Does your chart or does your report in any way negate the possibility that he received one, more than one injection of insulin, or two, when he got it? You don't know.
That chart is solely based on those assumptions I've
Assumptions.
stated. Okay.
Fair
so
enough.
I haven't made other charts based on other scenarios.
Right.
It's all it's that approximation, and anything else would be a chart based on another hypothetical situation.
Based upon your research into Humalog, it would kick in how many minutes? 5 to 25 minutes?
I had 10 to 15, but
10 to 15
Okay,
minutes?
yeah.
Okay. So that's when the Humalog would be effective.
So what I read, just to restate clearly, is that you administer it 10 to 15 minutes later, it sort of gets into the system and starts acting. It peaks at 1 hour and can last anywhere from 4 to 6 hours.
And the effect of that would be to bring down the blood glucose level, correct?
That's what insulin does, yes.
Doctor, you, on the last portion of your report, you say, I am relying on information you have provided me at the present time. Thus, my opinions are preliminary, may change if other information is offered for me to review. And you reserve the right to change your.
Absolutely.
Since you were not provided with blood glucose readings in the afternoon or the early evening, you were not provided
enough.
with the circumstances under which the victim or Mr. Cochran got to the hospital. That's all new information to you today, isn't it?
Yes, it is.
Are you aware that the defendant is a trained pharmacist?
I was told that, but I don't know her qualifications.
Okay. Are you aware that she held herself out to be a specialist in diabetes?
I did not know that.
Wouldn't you agree with me that someone with that kind of background and training would be well acquainted with the impact of insulin?
I don't have any way to judge that. I assume so. If she has those qualifications, even as a medical student, I was aware of insulin, and I'm sure parents who have, or other people who deal with diabetes know how insulin works, but I haven't judged her on her qualifications or discussed it with her.
Right. But just as kind of a generic matter, somebody that's a pharmacist and an insulin specialist would certainly be well acquainted with insulin and how it affects the human body.
Correct. If those first two statements are true, then the conclusion would be that he or she should know how insulin works.
Right. Doctor, you've been presented with a bunch of new information today. Has any of that caused you to change or alter your opinion?
No, it has not.
Thank you, Doctor.
Redirect Mr. Sullivan.
Thank you. Dr. Banerjee, since the prosecutor has brought it up about other cases, what famous cases have you worked on before?
I don't know what's famous per se, but
Well known, a
Well,
lot
you
of
get-
notoriety, a lot
I
of
mean-
press coverage.
yeah, it's hard for me to distinguish in the sense that some of them I consult on and some of them I cover as an expert in the media. Personally, I feel very proud. I know I worked on Breonna Taylor's case for the civil suit.
I'm sorry.
Oh,
Could you
Breonna
please speak
Taylor.
up a
She was
little
a
bit?
she was
Okay,
a shooting
closer.
victim. So that was an important interpretation. I worked with an attorney on that case.
Mhm.
I don't want to say more about it, but I cover. So my work as an assistant medical examiner was dealing with deaths within the state of Rhode Island. One of my cases was made into a forensic files that I was interviewed for, and it's also an A&E show. So I don't know if that's famous, but it's been on TV. My specific work on those cases.
I take oxycodone every day. Every single day. Yeah, no. I've hurt my groin. Yeah, we did. Yeah. Yeah, it's been shitty. Shitty the last couple. Stress brings it on. So, well, doesn't help.
It was solving actually a very decomposed person solving that murder. So that's one way.
Yeah,
I guess
no,
you can say
we did.
famous. I
Definitely
work on a
did.
litany of cases, and it was asked how I was contacted. It's whoever decides to contact me, and then
Don't be
I
sorry,
also
straight
do
up.
commentary or
Nothing you
whatnot,
can
and I'm
do.
presented with I would say, more known information where I'm not the primary autopsy pathologist, and in everything in between. Right, when I do legal consulting, I'm given privileged information, right? So I say retained, meaning that I'm allowed to work with the attorneys and get medical records or private information and then give my opinion on the case.
Okay. Now the prosecutor went to great lengths to talk about insulin as a perfect murder weapon, unquote.
Definitely
Is it-
his words, not mine. Yes.
I'm going to clarify.
Okay.
Now, insulin is not a
Yeah.
perfect murder weapon because it can be detected when someone's admitted to the hospital, right? There are tests to detect it then, right?
Tests exist. They can be done.
Right. And even
Exactly.
after death, post-mortem, there are tests to test for insulin in the tissues, in the fluids, et cetera, right?
It's possible. Yes. The body has to be much more intact. So it'd be soon after death, but it can be done.
Right. If you were told that Michael Cochran's body was not cremated, wouldn't any signs of insulin that you could trace or find out about post-mortem be destroyed by cremation?
I mean, the whole body is destroyed with cremation. So that's,
Right. And
a very
And-
one-directional process, if you will.
Okay, and if someone was trying to hide a murder by insulin, wouldn't it be wise to cremate the body?
I think that's speculation. I have no opinion on the matter at this point. I mean, cremation
Well, if you're going to hide it, you would, wouldn't
turns
you?
the body into ash. It's a high temperature process.
And you couldn't test that body for anything if it's turned to ash post-mortem, right?
Correct.
Now, were you aware in the medical records that Michael Cochran had a seizure event in October 31st of 2018 through about the first week or two of November 2018?
I'll believe the dates, but I know it was like the year before. That's where that seizure event happened and where this possible brain mass was suggested.
And that's well documented in the records, isn't it?
That was solely extracted from the records. I just used those facts.
Were you aware that Michael Cochran was subsequently referred to a Dr. Melanie Ward, who prescribed for him anti-seizure medication?
I'm not aware.
If that doctor prescribed anti-seizure medication, that would suggest he had seizures, right?
I know he had that seizure. I don't know about subsequent seizures.
Then there was talk about Michael Cochran's blood glucose level being 21 when he arrived at the emergency room in the hospital. If that occurred, if his blood glucose level was 21 when he gets to the emergency room, they treat that, don't they? They try and raise the blood glucose level by administering glucagon or dextrose or D50, right?
So I'm not an emergency room provider, but in him, he got a vial of D50, which is high concentration dextrose solution to try to give him a dose of sugar, a high dose of sugar.
And D50 does normally raise the blood glucose levels, right?
Yes, it's supposed to, yes.
Now, perhaps Dr. Dragovich would have better addressed this question, but if someone has a head injury, like is alleged in this matter, fall, hit their head on the counter, pass out, fall to the floor, you don't always have an external sign on the head of any kind of concussion, right? And I'll give you an example. There are many examples of, like, football players who sustain a concussion while playing. There's no external signs of it. And later on, it surfaces that they indeed had a concussion that causes brain problems. You aware of that?
I don't feel comfortable commenting on that. I can talk to you about postmortem diagnosis of what I've seen in brains with and without a concussion history, about the clinical presentation.
I have a suppressed immune system, and I take steroids. I have to. I was actually just looking that drug up, but I can't. I know it's an antidepressant based serotonin, but I can't actually see what drug it is, because I take a similar one at night. It's called amitriptyline. Yes. I just looked it up too. Oh, I need that. I don't have trouble sleeping. I have trouble staying awake.
Of concussion. I don't diagnose concussion. I do watch a lot of football.
Yeah.
So
And you're a Buffalo Bills fan, right?
no,
No.
I'm a Ravens fan.
Oh, okay.
That's on the record. And so I'm very sad about the Super Bowl. Nonetheless,
It depends on the dosage.
sorry.
Certain
I'm
dosages
probably watching,
levels,
but yeah.
certain dosage levels treat one thing, and they've found that at a higher dose it treats another. So what were you taking prednisolone as well, Anna? What immune suppressant do you take? Is it methotrexate or and what for? Have I asked you that before? I can't remember.
Yes. Where was I? I don't clinically make any assessment of concussions. If it's noted in the history, just like if a seizure is noted in the history, that would be a significant history. But a concussion brain, even at autopsy, can look completely normal, which is always something that surprised me because it can be a significant impact leading, that the person sustained previously. And there can be microscopic signs, again, getting into wider diagnosis and issues. But nothing is also always present or always absent. So nothing in medicine is 100%.
Which arthritis? Is it rheumatoid or? You normally get up early, don't you? I'm not a morning person, not with arthritis. That's why I stream at night. Takes me all day to get going. We're nearly done here.
Your chart, that by the way is still on the viewer.
Oh, it is. Well, partially, yes.
Those numbers are strictly from medical records that you reviewed. Is that right?
So I want to do one thing. So the date, the glucose were extracted data points. Okay. I used a time calculator to then calculate the interval. So it's not like the medical records had that time since 12 o'clock. And then I did an interpretation based on the medically available activity of this pro to say whether it would have been based on that time calculation, whether it would have been in the body. That's exactly how that chart was formed.
But what I'm getting at is you weren't provided emails. You don't know about statements of other people, blood glucose levels at various times during the day, unless they were documented in the medical records.
Correct. I showed you the sources and I told you the sources of which I relied on.
Know what you're talking about.
A moment.
No idea.
All right.
Yeah. I've got it everywhere.
Now, Michael Cochran was definitely diagnosed with an enlarged heart, and he had that condition, which is well documented. Isn't that correct?
I think there was suggestion of it in the medical records. It's well documented at autopsy. That's the most important finding.
Okay. Now, wouldn't an enlarged heart on autopsy support the proposition that Michael had high blood pressure?
So it's not necessarily a diagnosis of hypertension, which is what we in lay terms call high blood pressure. I think that is like a genetic disease, which runs in my family as well, and many families, and is a common ailment. However, if you use medicines that relatively raise blood pressure and use them for a long time, they can have the same effect on the heart as having high blood pressure. Does that make sense? It's not high blood pressure in the hypertension diagnosis sense. It's a sequela of using a stimulant like the pseudoephedrine, which is a stimulant, and that acts to tighten the blood vessels, which then would raise your blood pressure. So if you do that long enough, that could cause that enlargement of the heart.
Okay. Now, if someone like Michael Cochran had high blood pressure, but they were attempting to hide it from their doctors.
Wait a minute. This is way out.
Yeah.
Sustained.
Okay.
Fuck's sake. You're an idiot.
You have no concept of the geography in and around Beckley, correct?
No, sir. I walked half a block at lunch. That's about it.
So if
What's that got to
the
do with anything?
address of Michael and Natalie Cochran were on 4H Lake Road and it's only 7 miles to Raleigh General Hospital, would you accept the prosecutor's proposition that it took
Yep.
30 minutes to get there?
I
Does that
have,
sound reasonable?
I have no way to say
Okay.
one way or the other.
All right. I don't have anything else, Your Honor. Thank you.
All right. Any further questions, Mr. Truman?
The defense brought up about Dr. Dragovich, and the two of you seem to be a little bit apart on this. He indicated that cancerous tumors are tougher, for lack of a better word. You were here. You heard what he
Oh,
said.
yes, yes.
There was never a finding of a pancreatic tumor, was there?
So let me break that down in two parts. One is there in the medical records, there was no documentation, okay? In the autopsy, you could see by the condition of the body that even at the first autopsy that I'm saying, the pancreas does something called autolysis. It eats itself due to the enzymes. And even with which is sort of like dissolving it with acid, if you will, right? It like sort of disintegrates. And so even a tougher tumor, which I don't know that information, he offered that, but now to comment on that, it would still be susceptible to complete degradation by the time the first autopsy was done.
I guess the answer to my question is no. There was never a pancreatic tumor found in Michael Cochran.
So I can't agree to that because,
There was one found?
please let me explain.
Sure.
Okay, that's what I'm here to do. One is in the medical records, there wasn't, okay? I think a decomposed body, you cannot conclude whether one was or was not there. That is a limitation. So, right, it is handicapped. So I cannot accurately say if the organ's not there or so in poor shape to evaluate, I'm limited by that to say whether a tumor had been there.
That's not what I'm asking. The question is, there was no tumor found in his pancreas, was it? Not
By who? By who?
Kubitschek.
Dr. Kubitschek did not find one.
Okay. Do forensic pathologists rely solely on what they find in the dead body?
No.
They
So if I can explain that,
Sure.
yeah, that we don't practice in a black box, okay? But I think, again, the autopsy is a gold standard. That is the collection of data that's collecting as much evidence. And we have a unique perspective, right? No one else is doing the dissection or collecting that data, like where Dr. Krieger is not qualified to comment on cause and manner of death. With that being said, you still take the investigation into, or the circumstances surrounding death into play. But there are so many unknowns here that undetermined cause and manner are appropriate.
Right. Would an enlarged heart in and of itself cause hypoglycemia?
No, but if he has an arrhythmia and then starts getting dysregulated, he could have hypoglycemia.
And that would just happen within minutes, hours?
I couldn't say.
Okay.
Tanya heard, well, maybe saw him somewhere else, apparently.
And would an enlarged heart
No, it
cause a
wasn't.
blood glucose level of 21?
Again, it's not a direct cause. If he becomes dysregulated, if his body shutting down, that could happen.
And that would take how long?
I don't know. We're all different.
Okay. Doctor, thank you. That's
Yes.
all the questions the state has.
Anything, Mr. Selvin?
Very shortly. Doctor, the
Yeah.
pancreas, which is responsible for insulin production in the body, is an internal organ of the body, right?
One of the major organs
Okay.
that I look at every case. Yes, we all have one.
And isn't it true when the body begins to decompose after death,
Yes.
that the internal organs, like the pancreas, are the first to decompose,
Fucking ask.
So-
as opposed
Oh my
to
God.
the skin,
Okay.
the hair, the bones?
So everything starts decomposing, some at different, faster level, faster rates than others. I mean, if we look at everything at the microscopic level, once the person is deceased, not getting oxygen, everything is disintegrating. We're no longer living. We're not getting the nourishment. Okay. But I would say the GI tract, meaning the tube, the stomach, your esophagus, stomach, pancreas, et cetera, gallbladder, those are very sensitive organs full of enzymes and bacteria that normally live there and are contained, but upon death are released or penetrate through to first decompose these structures. And they're very susceptible to decomposition.
And after a body has been decomposing after death, and it's 7 months before an autopsy is done, you could not tell whether there were microscopic pancreatic tumors because of the state of decomposition. Isn't that true?
This was a moderate state of decomposition with insect activity, which would limit analysis of all organs, especially the pancreas.
No further questions.
Anything, Mr. Truman?
That's for the fun state, Your Honor. Thank you.
Thank you very much, Doctor. You may step down. You are excused. Come up, please.